My name is Amber Khan, and I will be doing my informative speech on cerebral palsy. Cerebral palsy is unique to each individual that it affects. It is caused from the brain development of a child before, during, or after childbirth. The main points that I will be covering are the causes of this disorder, the symptoms of this disorder, and the treatments for this disorder. Who can get this disorder? Babies can get this disorder, which is caused from premature birth, lack of blood, oxygen, and other nutrients that it needs while the mother is carrying it. And it can also be genetic, passed from the mother to the child. Young children can also get this from a brain injury or a serious infection that will cause abnormal development in their brain. There are 4 different types of cerebral palsy that I'm going to go over. The first one is spastic cerebral palsy. This one causes muscle tightness, usually in the arms and legs, problems controlling their movement, which means usually their legs will go out when they're walking, stiffness and weakness in the body. 80% of cerebral palsy cases are spastic cerebral palsy cases. The second one is athetoid cerebral palsy, which is changes in the way muscles grow, and their speech is affected, and also their posture. Usually they can't hold themselves up for long periods of time, and they can't get what they're trying to say out. They have a problem communicating with people, and 10% of cerebral palsy patients are athetoid cerebral palsy. The third one is ataxic cerebral palsy, which is problems balancing and also speech problems. They usually have to walk with a walker or a cane for their whole life because their bodies will just give out on them while they're walking. The last one is mixed cerebral palsy, which is a combination of 2 different types of the disorder. And it could make them have speech problems, not be able to walk, and just a combination of everything. There is no cure for this disorder, but there are treatments that can make the disorder better for them. The first one is therapy. They have to go through speech therapy to learn how to communicate with people and to be able to say their words right. Usually they won't know how to spell unless they're taught over and over and over again. They have to be taught life skills. They have to be taught how to take care of themselves in case one day there's no one there for them. And physiotherapy is there to kind of help them through their disorder so they can cope with it better. The second thing is surgery. This helps to improve their muscle growth. They usually do it in their legs when they're babies. That way, as they're growing, when they're older, their muscles can extend. If they don't do this surgery, then they probably won't grow, and then they'll have really bad muscle spasms all the time, and they won't be able to control the way their body moves. And there's also orthopedic surgery to help their bones grow. They can also take medications, which consist of injectable antispasmodics, and these help the spasms inside of their legs and arms, and they can also take anticholinergics. This is just cerebral palsy at a glance. I've actually experienced this firsthand. My godson has it. Cerebral palsy is a disease that affects babies and young children. There are many options to help children unfortunate to have this disease be able to grow into adults and take care of themselves and be able to make it in the world. Thank you.